Welcome to the Health Equity Curricular Toolkit. This podcast was designed to assist facilitators in using this toolkit. My name is Jennifer Edgoose. I have led in the design and production of this resource along with my colleague Sarah Davis. I am a faculty member at the University of Wisconsin's School of Medicine and Public Health, Department of Family Medicine and Community Health.
I am Sarah Davis and a faculty member of the University of Wisconsin-Madison School of Law and Center for Patient Partnerships.
The objectives of this podcast are to share why we collectively created the Health Equity Curricular Toolkit and to introduce you to the design and use of the Health Equity Curricular Toolkit. We did want to briefly acknowledge that we are part of the Health Equity team of Family Medicine for America's Health, and you may read more about our work in our Toolkit's guidebook. So why did we develop this curricular toolkit? Many of us practicing and teaching in primary care and public health are well aware on a daily basis of the vast inequities that exist within our exam rooms, classrooms, and even as we confront the public spaces of our private lives, including the streets we walk down and stores we shop in. The persistent and pervasive nature of health inequities in healthcare are well documented in books such as the Institute of Medicine's Unequal Treatment, mandated by Congress, reviewing over 100 studies, which concluded in 2002 that racial and ethnic minorities receive lower quality healthcare than non-minorities, even when income, insurance status, and medical conditions are similar. The more recent Black and Minority Health Report from the Secretary of Health and Human Services shows how significant racial and ethnic disparities persist despite attempts to attend to these issues for the past 30 years. Beyond racial and ethnic disparities, ongoing disparities continue to exist around gender and perhaps most profoundly for persons with disabilities. And even our local news sources provide a daily barrage of persistent and sometimes shocking health disparities at all income levels.
So we bring you the Health Equity Curricular Toolkit as we believe you, like us, want to advance equitable outcomes for all people, and we need more practical tools to support a structured approach that assures we are promoting equity for all. The material you'll find in this toolkit was inspired by the Starfield II Health Equity Summit held in Portland, Oregon in April 2017, which brought together thought leaders from around the world to share in a rich discussion of how we all hope to achieve health equity. Barbara Starfield was an American pediatrician at Johns Hopkins University who was devoted to the academic advancement of primary care and co-founded the International Society for Equity in Health. Dr. David Williams, renowned professor of public health and of African and African American Studies and Sociology at Harvard University, provided an opening keynote address about disparities, socioeconomic determinants of health, racism and bias, and ended with a call to action. This was followed by short, stimulating, what we called Ignite talks that focused on larger themes such as social determinants of health. Here we list the titles of the talks given and their speakers. Another large theme was under the category of vulnerable populations, defined as populations living in vulnerable environments. And finally, we spent half a day focusing on Ignite talks on economics and policy. All these talks were captured in videos and slide sets, and each speaker then led a small group discussion with conference participants, and notes of these discussions were captured. The conference ended with a talk on social accountability as it relates to healthcare. We defined social accountability in healthcare as healthcare that intentionally targets healthcare education, research, and services, and addresses social determinants of health towards the priority health concerns of the people and communities served with the goal of health equity. Participants of the Starfield 2 Health Equity Summit spent time brainstorming strategies to move towards actionable, socially accountable steps inspired by all of the preceding Ignite talks and discussant groups.
Given the wealth of information captured at this conference, we felt the material in the conference was a rich resource to further teach and explore issues of health equity with a wider audience. So first, we wish to introduce you to the guidebook to the Health Equity Curricular Toolkit. We encourage facilitators to read this and provide this as a resource to their learners. This toolkit was an interprofessional collaboration with 39 module writers and conference speakers participating from across the United States and Canada. Module writers included a Dean of Diversity and Inclusion, family medicine faculty and residents from academic and community-based residency programs, nursing faculty, public health practitioners, a lawyer, and students of both medicine and public health. You'll find a table in the guidebook that outlines the introduction, overarching goals, and a call to action, audience and learning modules with a description of categories, framing, and organization, definitions and high-level health equity resources, and an equity and empowerment lens worksheet may be found at the end of the guidebook. Finally, there are a couple sections specifically focusing on some essential thoughts around facilitation. This will be reviewed in a supplementary podcast called Facilitating Conversations about Inequity, Oppression, and Privilege.
We believe a broad audience can use this toolkit, including practicing clinicians and healthcare professionals, but our target audience is clinical and public health learners and primary care faculty and fellows. We have noted each module based on who they are most accessible to. All learners, advanced learners, which could mean those who have used several earlier modules. We should also note there is one module that is designed for faculty and fellows. Modules are organized by the large themes of the original conference: social determinants of health, vulnerable populations, and economics and policy. Each module then provides a macro to micro framing of material to assist learners and facilitators as they pursue a deeper dive into each module. Each module contains the following: learning objectives, brief background context, the Ignite video, each about 6 to 12 minutes and led by an expert in the field, and the accompanying slides of the videos. A few modules lend themselves well to combining two Ignite talks, so these will have 2 videos and slide sets. A series of proposed questions for the facilitator for group discussion, an invitation to propose an actionable response to the discussion with an opportunity to apply an equity lens, links to materials in an annotated bibliography for more in-depth reading and more advanced discussions set up in a macro to micro framework, and a list of words and concepts used in the module that are defined at the end of the guidebook to encourage common language and base understanding for facilitators and learners. While we have designed this toolkit to be modular, with 14 modules to be used at the discretion of each facilitator, we do strongly advise starting with the introductory module. This is a longer 2-part module that provides both Dr. Williams' longer keynote address and closing discussion on social accountability. This latter module provides a health equity and empowerment worksheet that can be a practical resource for application in subsequent modules where we challenge participants to propose actionable steps as part of the learning experience. The entire video portion thus is about 1 hour and 25 minutes. Facilitators need to consider time limitations and can either provide the videos and slide sets as homework to be viewed in advance and allow for 1 to 1.5 hours of time for group discussion. Alternatively, please be prepared to reserve time for a 2.5 to 3.5 hour workshop if you wish to view the videos with your learners. This slide shows a sample module. Please note the timestamp. As a facilitator, it may be worth considering a quick search for more up-to-date resources. Also, at the top of each module, we provide a recommendation of the appropriate audience and a list of related modules that facilitators may like to consider if they are able to teach a series of modules.
We hope you found this orientation to the Health Equity Curricular Toolkit useful. If you have any questions or feedback, please contact Jennifer Edgoose or Sarah Davis. Our sincere thanks for your interest in utilizing this resource and for advancing principles and practice that promote health for all people. We end with a Robert F. Kennedy quote provided in David Williams' keynote address. Each time a man stands up for an ideal, or acts to improve the lot of others, or strikes out against injustice, he sends forth a tiny ripple of hope, and crossing each other from a million different centers of energy and daring, those ripples build a current that can sweep down the mightiest walls of oppression and resistance. Thank you.